Lesotho is among the top 20 countries with the highest TB and TB-HIV incidence rates globally. According to the Global TB Report of 2017, the estimated incidence was 724 per 100,000 population. In an effort to improve and strengthen the health sector's response to tuberculosis and occupational lung disease, the World Bank, the African Union Development Agency (NEPAD), and the East, Central and Southern Africa Health Community launched the Tuberculosis and Health Systems Support Project, otherwise known as the SATBHSS, in 2016. The SATBHSS is implemented in 4 Southern African Development Community or SADC member states, amongst which Lesotho is included. 4 implementing agencies were involved in bringing the vision of the SATBHSS into fruition in Lesotho, namely the Ministry of Health, the Ministry of Labour and Employment, the Ministry of Mining, and the Ministry of Law. The eradication of priority health and social welfare issues is the main function of the Ministry of Health. In the SATBHSS project, their contribution entailed strengthening primary health care, implementing community-level interventions through the Centres of Excellence, improving laboratory infrastructure, as well as controlling the spread of TB through cross-border collaborations.
The Southern Africa Health System Support Project, that is SATBHSS, has done a huge impact in Lesotho. 90% of our cases are now bacteriologically confirmed through our lab. It has improved our lab, now it's internationally recognized.
We have embarked on this TB case detection in the community to close the gap in terms of finding the missing TB patients. And we have started since 2019, and we have been using the mobile digital x-rays, which we also used when we were conducting our TB prevalence survey. We're implementing this in 3 districts, Maseru, Leribe, and Berea. So the approach is to work with the chiefs and using the local communities, the village health workers, and the community volunteers. What we do is we invite them TB screening and inviting them to the temporary clinics, whereby we have these mobile trucks and we use them in addition to the 4 symptom screening.
The main objective of the project is to improve the TB treatment coverage, okay? So there are 3 teams. Each team is made up of 1 doctor, 2 nurses, 1 radiographer, and 2 drivers. So in essence, what we do provide TB services at the community. Whenever a patient presents with one of the symptoms or with any abnormality on the X-ray, the patient will be asked to produce a sputum, okay, which will be taken to the lab for analysis. Once the result is positive, the patient will be linked to the nearest clinic for the treatment.
The SATBHSS project supported the lab in renovation of the NTRL to meet the international standard and the BSL-3 containment. It also supported us with a human resource, 2 technologists, 1 mentor, and 1 microbiologist.
We now initiated disease surveillance cross-border collaboration, which assisted in getting a team of members from Lesotho and South Africa together so that they look into the public health emergencies that may appear or that they are prone to at the border, so that at the end of the day they respond to such emergencies together. So through the projects we were able to develop what is called a multi-hazard response plan, which now we had to get support first to start with the risk assessment to identify the type of public health hazards that we are prone to, and subsequently developed the response plans for such and then the contingency plans.
The Ministry of Labour and Employment had a clear focus on addressing TB through the implementation of labour-related legislation to protect workers.
The assistance that was provided was monetary because we had to engage consultants to undertake the OSH profile Even the policy review was done under the assistance of a consultancy as well as the legislation. But also in sponsoring social dialogue meetings where we convene employers and workers as well as government through various sister ministries that are key stakeholders in occupational health and safety, so that these products are informed by mainly the workers and the employers, as the law provides that the minister has to be advised by workers and employers through various statutory bodies. But in particular, for purposes of this piece of work or pieces of work under occupational health and safety, is the National Advisory Council on Occupational Health and Safety. So the project has assisted us to have these meetings whereby we consulted the various stakeholders before undertaking the work that we've presented.
TB and occupational lung disease are prevalent in the mining sector. As part of the project, the Ministry of Mining was committed to alleviating the effects of the disease in the mining sector.
A lot of our miners who are coming from South Africa, from working in the mining industry in South Africa, coming to work in the industry in Lesotho. And we didn't know how to trace them, how to find their well-being. They were just taken into the mining industry in Lesotho and working. We really didn't know how to coordinate the mining activities in terms of health-wise. We developed a national policy for health and safety in the mining industry. After that, we were able to develop a legislation, the act. We were able to develop the guidelines and the regulations. So the key important factor in those legislative tools is that we are now finally able to put the standards and threshold on which the industry must be performing. We are also able to test the occupational exposure limits for the dust and other exused fumes that are produced at the mines. Apart from that, we're able to make the legal appointments to make certain people responsible for the safety and health of all people that are working at the mine, from the mining companies, and also we're able to appoint regulators who are going to have the key responsibility in ensuring that all the health and safety legal framework are being complied with.
Correctional institutions in Lesotho are identified as high-risk areas for transmission of TB amongst inmates and correction staff. This is further worsened by the high burden of HIV in these institutions.
We did not have a place where we will separate those who were very seriously ill and those who were not that bad. So we were putting them in the same place. But now that we have this place, it means that we are in the position to separate them. This will help us because we are no longer going to have problems which we had earlier when they were all in the same place.
The SATBHSS project is actually helping us to build isolation facilities in the whole of Lesotho Correctional Service. But our target now is Maseru Central Correctional Institution. That is where we have just built new isolation cells. With the help of the World Bank, of course through the Ministry of Health in Lesotho, we are now able to manage our contacts well. We are now able to screen inmates better than we did before. I think we are beginning to see some decline in the number of TB patients.
Since the inception of the project in 2017, until now, we have realized the decrease in incidence in Lesotho by 7% annually. And this we have achieved through the support of the project, through various interventions at facility level and community level. In terms of strengthening health systems. In terms of infrastructure, we have supported the National TB Reference Lab. We have refurbished the lab and created laboratory space for TB diagnosis at Motebang Hospital. And through the collaborative structured mentoring program, we have been able to make sure that our 2 laboratories now have been accredited by SATBHSS. And The second achievement is that through our community health services, we have introduced a new screening tool, which are the x-rays, whereby we take the services to the community level and diagnose TB at community level. And this has impacted so much on the health system, because we are taking the services to where the people are, and we have improved our primary health services through that integrated TB community services.
This project has done a huge impact for Basotho and Lesotho. We really thank AUDA, NEPAD and EXA for their coordination, as well as World Bank for this important in financing this important project. We thank you so much. EXA, we thank you so much. World Bank, we thank you so much. NEPAD, for your support in Lesotho. Thank you so much.